Yesterday was our big buyout, and it is being spread out through a week. So we have another group coming in. That group will be coming in during our retreat, which I will be very busy at. So this will be the main debriefing, and then we'll have to see if we are able to get to it. It just depends on how many animals are in our lives. But this was the first big, beautiful guy during our debriefing. One of the most beautiful manes I've seen.
Yeah, we took 21 horses in yesterday, and I said this at the start of the last debrief. If I seem detached, it's how I cope to get through hard conversations. So we're going to go through the 21 horses that we took in yesterday and give you some more details on their condition. This first one that we pulled right off the bat was a 27-year-old stallion. We thought he was a Percheron, and he was a very, very, very good boy with just, he was like a magical unicorn mane and tail.
He had some pretty severe health problems.
It's hard to tell from this photo, but he was very, very thin. He was missing multiple teeth, and our biggest concern with him was that he had painful back legs. So he had DSLD, which is deep suspensory limb desmitis, in both of those hind legs. It's really hard to tell with the feathers. You have to palpate the leg, but he also had some swollen hocks and a lot of discomfort from those hocks. He had discomfort in his mouth. He had discomfort on his back. And he also was a stallion at age 27. So you guys have heard me talk before about a castration being a major surgery. We are not able to adopt out intact animals. So he was given the last act of kindness, not because he was a stallion, but because he had uncontrolled pain. He did get pain meds. He did have diagnostics, and we decided unanimously that it was the right choice for him.
We see a lot of DSLD, and it's something that visually looking at it, the untrained eye might be like, oh, the horse should be fine. But the way the horse's weight is standing is not proper and is putting a ton of pain and joint. Like it's really, really sad.
It's chronic, progressive, incurable. So like a lot of those other disease processes that we talk about, a horse much earlier on in the disease process might be managed. I actually had a Percheron with DSLD, and by the end of his life, he was on 3 different pain medications. One of them was an injectable medication, and I wasn't able to control his pain. And his legs didn't visually look as bad as this guy's did.
A beautiful horse. You can kind of see, it's interesting with white horses, it's hard to see how skinny they are in the photos. But just such a beautiful boy.
This mare is a 20-year-old Belgian. She is blind in both eyes. We aren't ever sure how much the shipper tells us is true, but we were told that she came in with the stallion that we just told you guys about. She has a tagged left ear, so she had a rip in her ear, and she had a lot of scars on her legs. She also had a pretty strong evidence of having had many foals. So I think this mare was probably used as a draft mare. She has
a brood mare. Mm-hmm.
I'm so sorry.
You said a draft mare.
I said a draft mare. Yes. My brain is...
these buyouts are emotionally draining. They're very emotionally draining. It's one thing, I think it was like the first time I went out on a huge rescue mission, and I was used to seeing, 3 or 4 skinny horses. And this one rescue mission I went out on, it was huge, and there were 300 emaciated horses and dead horses, and you go into a triage mode, and it's a lot to process. So if we seem tired, if we seem a little teary-eyed, if we say a draft mare instead of brood mare, just give us grace.
Well, I make mistakes like that even when my brain
give
is
us
fresh,
grace.
But so this mare we think is about 20 years old. She's missing or worn to the gum line almost all the teeth on the upper right side of her mouth, but she still has some teeth. She still has a functional occlusal surface on the left side of her mouth. We basically are putting her in a hospice type situation. To be adopted out, she would need a bilateral enucleation, which is removal of both of those eyes. It's a big surgery. It's a big recovery. And so her eyes aren't acutely painful like some of the ones that come in. So we were able to give her kind of a decompression period. And I checked on her this morning. She's very sweet. She's easy to catch, and she seems to be doing really well. She's in our 10-acre pasture, and she found a pasture buddy right away. So she's got a little seeing eye pony, and she's found the pond, and she's doing okay. But we are concerned about her, and she's got a lot of medical concerns that we have to overcome.
It's always important to remember that these horses would have gone to slaughter if we hadn't have intercepted them. And we're doing everything we can for them to the best of our ability for each horse. And yesterday when we turned her out in the 10-acre pasture, you know, she walked out there and then she laid down and she rolled. And like she's able to be a horse and be happy right now. And even though she's in a hospice type of situation, like she's living her best life right now.
She also chugged 20 gallons of water, which I know because I filled up 2 5-gallon buckets twice. And ate almost like 3/4 of a square bale of hay. Like she came in, we put her in a stall, and she obviously hadn't had access to food or water, probably because she couldn't find it. So yeah. It's rewarding to watch them get what they need.
She's definitely enjoying being here.
Yeah.
Aww.
This little guy is a 1.5-year-old mule. He does need to be castrated, and you can see in the picture his left eye either had a severe corneal ulcer that we call a melting desmetocele, which means the cornea gets so badly infected that it just kind of melts and makes a hole, or he had penetrating trauma to the eye. Thankfully, the eye is stable. So you can see he's got it nice and wide open and he doesn't have a lot of tearing, but I do think that he will need that eye to be removed before he is adoptable. He's very sweet. I have young and wild but sweet written on his chart. So taking an eye out involves a lot of aftercare for surgery. And so before we feel like we can do a good job with that surgery, he'll need to be halter broken and have some more work done. But systemically, he's doing really well. I think he's going to be a very big boy. And he is turned out in our pasture with others that need to be castrated.
Yeah, he's still growing. And we typically don't get mules here a lot, and usually because mules are very desirable in this area, and they're not just being turned into rescues unless there's something wrong with them. And in this case, he does have a bad eye, but we can't fix the eye, but we can fix the area where there's an issue, and he should be able to go on and live an awesome life. Just a one-eyed mule. Aww.
This mare, we aged at 30 years old. I think she actually might have been older than 30. She was in pretty poor body condition score, and she had some lung sounds and some nasal discharge and some pretty bad conjunctivitis. We noticed right away that she was very, very uncomfortable with the way she was walking in the front end, and you can see her carpi, the 2 main joints right in the middle. She had a lot of soft tissue swelling all the way up here, and then down here there were a lot of bony abnormalities. So this was all rock hard, and up here was all soft and poochy and warm and irritated. So she immediately got pain meds. We sedated her and took some radiographs, and unfortunately we found that she had fractures in both of her carpuses that looked to be old, and then she had partial joint collapse in both of those knees. Very, very painful, sharp pieces of bone rubbing on each other, and she was given the last act of kindness.
She's a very sweet horse, but she could have just disappeared into the slaughter pipeline and had a horrific death, a fractured tooth. Like she had so many things, and like sometimes we can turn them out in the 10-acre pasture, like the draft horse, and then sometimes it's like we need to end this suffering now because we can't control the pain.
This was a 23-year-old standard-bred gelding. We were able to look him up based on his brand and confirm his age for sure. And you can see his right hind leg was an immediate concern. He was given some pain medication. He had a large puncture with chronic drainage. We actually had a couple horses that had similar wounds present. And what we found when we took radiographs of that leg was evidence of an old fracture that had created a chronic draining tract associated with that hock joint. So when we have joints exposed to the outside, it's very easy for those areas to get badly infected. And this horse had a lot of heat and swelling associated with this leg. It was way too late for us to address the bony changes as well as the infection in this leg. And he was given the last act of kindness.
A lot of horses, they get these issues, the owners try to fix them, and when it gets to a point of like, this isn't going to be fixable, instead of working with their vet and saying, we should look into euthanasia now, because there's a slaughter price on every horse's head in the United States, these horses, their owners try, not working, throw them into the slaughter pipeline. And that's what we intercept so much of these horses, that their owners gave up on them and just walked away from that responsibility of being an owner that cares for the life of their animal.
Even if you couldn't get a veterinarian out to look at this horse, if you called a veterinary clinic and described, my horse has a puncture wound right over the hock joint, and described the fluid coming out, this is one that we never diagnose over the phone, right? But I've talked about, like I volunteer my time on an online vet group. Any puncture wound into a joint is an extremely grave situation where you have to immediately respond. This is like go to a university hospital and hospitalize this patient. And even so, the chances of them getting septic are pretty high. So hopefully this never happens to your horse. This mare is 19 years old. She is very, very, very thin. She's also very sweet. She has a funny, almost like vitiligo, which Dr. Gina and I threw around how you actually pronounce that word. I'm not convinced that's what it is, but she's had some loss of pigment on her muzzle and in front of her eyes that seems to be static. She doesn't currently have any dermatological issues in those areas. She was such a poor body condition score, and we actually had a little lull in between where I didn't have another patient, so I did her dental right then, and she had some very, very sharp points on both sides of her mouth that I was able to fix. So I'm hopeful that we can get her to gain weight. She is on a refeeding program, and she's turned out, and she's just an absolute sweetheart. She hears you and she comes right up in the field. She loves cookies, so hopefully we'll get her back up to condition. She also had some pretty severe hoof neglect, but I think all of those things are hopefully issues that we can correct. Oh, this poor boy. This gelding was at least 35. He was quite elderly. He had nasal discharge, increased respiratory effort, conjunctivitis, ophthalmic discharge, really bad scleral injection, and he also had evidence of icterus, which is an indication of end-stage liver disease. He had a lot of pain on palpation of his mouth, and he was missing multiples of his teeth, and he also had pain on palpation of his back, and he just generally appeared to be miserable. So I think likely the two main causes of concern for this boy were his liver disease and his dental pathology. But at 35, he was ready to go, and he was given the last act of kindness.
This is her before her haircut.
Do you guys feel the emotional whiplash that happens? I think it's also worth noting, sometimes we're able to snag the really critical cases right off the bat. And sometimes if they're wild, we can't get to them. So we give them pain meds right off the bat, but this is like, yay. So this sweet boy is only 7 years old, and he had such bad mats that Haley cut his hair. So if you look at later pictures of him, he has short hair.
It was just all stickers.
He is quite thin and has some pretty severe hoof neglect that you can't really see in these photos, but he doesn't have dental pathology. He didn't otherwise have indications of major health problems, and we're hopeful that we'll get him through to adoption. This snarky little one is only 2 years old. She's a little Molly mule, and she was very healthy, and we didn't have any health concerns with her. She obviously hadn't had a lot of handling, but she was mostly calm. You can't see how tiny she is in these pictures. This little girl is so tiny. Those legs are like this big around.
After intake, when I was leaving, she was laying down in her pen eating hay. Like,
While
I'm
laying down.
tired. I'm just going to eat. And then I pulled up and I actually went and videoed her. I think it's in the members video if you'd like to see it. You have to become a member on YouTube. But then, because I was there, she's like, oh, I better get up. And then she just kind of sat there like a dog for a little bit. She's so cute, so cute.
Yeah, so often these young horses that come through are just exhausted. The adult horses tend to nap standing up, but some of these babies, they come through and they get turned out and they're like,
we're done.
Susan, and then we always worry that they're colicking. But in her case, she's doing great. I just saw her a little bit ago.
This is the poor guy that
was
standing weird.
This is another standard-bred gelding. He was 33 years old, super sweet boy. And I don't know what's sadder, the ones that definitely know what cookies are and seek out humans, or the ones that have never been fed treats. This horse somebody loved and cared for at one point in his life. He came right over and you can see him enthusiastically eating the treats. His right hind leg was very badly swollen. He had a lot of pain in his lumbar and pelvic region. And actually this picture doesn't show it super well, but he would stand kind of camped out in back. And Tawnee's the one who noticed. She said, I think this horse has some back pain. And when I palpated his back, his lumbar spine and his pelvis were very, very painful. And he also had a grade 6 out of 6 heart murmur. So we grade heart murmurs on a scale from 1 to 6, with 1 being less severe and 6 being very severe. So Jason actually listened to this horse and was like, I think I can hear it. So
you give us a demonstration because it's not like the normal sound.
Yeah, and I think Horse Plus is unique in that we see a lot of blind horses. We see a lot of horses with cardiac pathology that you don't normally see and that you might not normally detect. And so anytime we can learn from these cases, we try to. But
so what did his heart sound like? Because I found that interesting when you were trying to tell us what it was like.
Let's see if I remember this. So normally we hear 2 crisp heart sounds, a lub and a dub. There's 2 heart sounds, and this horse had a normal lub, and then his dub was more of a like. It was just a loud sucking sound. The point of maximum intensity was on the left side over the mitral valve. So the left side of the heart has pulmonic, aortic, and mitral, and the right side has tricuspid. So even just with a regular stethoscope, the equine heart is big enough that you can move your stethoscope and you can hear each valve differently. And now that we have an ultrasound, we have the capability of ultrasounding the heart. And so his murmur and his presentation was most consistent with mitral valve insufficiency, which is something that we frequently see in older horses. And for the murmur to be that severe, it was likely advanced. I'm not a cardiologist. So if any cardiologists watch this and are like, man, she's wrong, please send me your information and I will learn. Dr. Gina's father was actually a human cardiologist. So Dr. Gina normally helps with these cardiac cases, and she wasn't able to be at intake yesterday. But this poor sweet boy got a lot of cookies and was given the last act of kindness. Oh boy. This gelding was 21 years old. And this is another great example. When you look at the picture of this horse, he looks to be very, very healthy. He's a good body condition score. But when you look at him more closely, this horse had severe DSLD in all of his feet, but most severely in the hind feet. And you can see that joint on the back leg is almost touching the ground. And you can see the bump on the side of his leg, that joint and the hoof in front of it undergo a lot of unnatural stress. So this is DSLD that we talked about before with the first stallion. It is a chronic, progressive, incurable condition that initially doesn't cause a lot of discomfort. And when it gets to advanced stages, it causes pretty severe pain. And not that it's perfect, but if you look at this horse's face and his demeanor, his whole jaw was really tight and clamped.
Nostrils are flared.
Yeah, he had absolutely no interest in human contact. So a lot of these horses come in and are afraid, and a lot of them come in and immediately seek human contact. And some horses have been in so much discomfort for so long or had such a poor experience that they want absolutely nothing to do with people. This horse was 21, and I do believe at some point he was probably broke to ride. But he was given the last act of kindness because his discomfort was obvious and advanced, and he absolutely had no interest in interacting with us or accepting anything.
Or other horses.
Yeah,
Like,
he was charging and pinning other horses in the corner and then turning around and trying to kick them. So, and this, I don't know how many horses we've been through. We tried to get him separated out as quickly as we could so he wouldn't hurt anybody else. And he was so agitated, and his trauma response was so strong that this was the earliest we could get him separated out. Poor guy.
Yeah, and like you said, horses that seek out human companionship, like there are those horses that are like, love me. And he was just like, he was in chronic pain. And if you can imagine, like, if you've had a migraine and it's to the point like everything in your world is just like no lights, no sound, no nothing. And that's basically what this horse was living in for years, probably.
Yeah, even caught with a halter on, holding grain or treats to his face, he just had his mouth clenched shut and wouldn't take anything, even after pain medication.
Yeah, so freeing him from his chronic suffering was the kindest thing we can do. And it's, for me, cases like this, it's like, why on earth would somebody not give that? Like, that horse is so clear. Like, he was showing every sign he could without a voice to say, I am hurting. And to just allow him to suffer like that is...
You can even see in this picture how he's pushing more of his weight onto his front legs to get weight off of his back legs. If you just glance at this picture, you're like, wow, that horse looks really healthy. And unfortunately, so many of the cases at Horse Plus we get, you can't see it in a picture.
Aw. I got this little guy.
This little guy is about 2 years old. He's a little stallion. He is covered in scars. I don't know what this poor little guy went through. He is very, very thin. And you can't even really see it on the side picture, but his pelvis is super pronounced. I mean, he is so underweight. And he just had multiple layers of wounds all over his body from different periods of time. He had some patchy hair loss, and he had nasal discharge and some scars up underneath his jaw. So I suspect he likely had strangles, which is strep equi. Strangles is not reportable. It is quite contagious, but he seemed like he was on the other end of that, but maybe that's why someone dumped him. And most of these horses had at least 3 auction tags. This guy had 3 auction tags. So he needs to be castrated, but I'm optimistic that we can get him to adoption.
Oh, this was our heartbreaking one.
This mare was 24, and she was very, very interested in humans, a little afraid of us. And she had a swollen left hind. It's hard to see from this angle on the inner part, the medial aspect of her left hind leg. She had, if you go back one time, you can see it. Yeah, right here. So it doesn't look that big, but if you go down, she had a big bony, this area right here was actually a horrible fracture. So this is why it's so important for us to have that diagnostic equipment. She was able to bear some weight on it. The fracture happened a long time ago, but it was a slab fracture that affected the medial aspect of her joint right there. And she had a lot of arthritis and bony proliferation and evidence of soft tissues affected. And she was very uncomfortable on that foot. And unfortunately, we couldn't have fixed that fracture. And she was given the last act of kindness and lots of treats. This might have been the most heartbreaking.
This one was very, very heartbreaking.
This little guy was a stallion. He was only 3 years old.
We thought he was a girl at first.
I called him a girl.
We were all calling him a girl.
Look how girly his face is. I shouldn't make assessments. But he looked like a mare. And also, you look at his back and you're like, that's got to be an old horse. This was a 3-year-old. And he was microchipped and registered to the jockey club. So we know that he was bred with the intent to be a racehorse. And his right front leg was very badly swollen and misshapen, and he obviously had some kind of significant injury. He actually had a couple injuries. He had puncture wounds on both of his hind legs and his right front, but then he had a big swollen carpus on the right front. And we took radiographs and were able to determine that he had an avulsion fracture, which means the soft tissues get pulled so hard that they rip off where they've attached to bone, and they rip little chunks of bone off with them. He was very uncomfortable and so tragic that a horse that's only 3 was just, we don't know what happened to him. But also, that sway back is really poor conformation. So I don't know what we're going for in the thoroughbred industry, but this animal
not
he did not have a promising future ahead of us. Ahead of him, he had a lot of back discomfort already as a 3-year-old, and he was given the last act of kindness. Obviously, if I don't say that they got pain meds, they all got pain meds.
Yeah. Because people have wondered about that. Well, why didn't that horse?
Yeah.
That's our priority. And like I said earlier, like we're in the middle of a triage situation. And for us, it's a given. Mm-hmm. And so if you're just listening, you might not understand, but pain meds are the top priority. I know for me, going out, and I was at this point trying to get different horses up to get into the barn to be seen by the vet, I noticed that there was just blood dripping out of the top above his carcass, just drip, drip. And that's why I was like, oh no. And then I noticed on his back leg, he was also dripping blood. And it was, what we see is really hard. And he is just such a beautiful young horse, just discarded.
And we always look at it from the outside and we're like, maybe we can fix that. This little mare is a tough one. So we've had several young draft horses recently that had severe congenital abnormalities. This is about a 2-year-old Percheron mare. I guess we call them, I don't remember the exact designation between filly and mare. She's very sweet. Someone's obviously worked with her a lot, and you can see that very large bump near her lumbar spine. So I was able to both radiograph and ultrasound that area, and the spine doesn't just come up this way, it twists. And she doesn't have active discomfort on the area itself, but I'm very concerned about her soft tissues and especially her nerves that are running through there with the angulation of the spine right there. She has vertebrae that shouldn't be touching each other that are overlapped with each other. I'm also very concerned about the possibility of other congenital abnormalities. She was stable yesterday. She's not in acute distress. Some of the other cases with bad congenital issues came in and they had like 8 issues. So she didn't have any indication that she had end-stage organ failure, but Dr. Gina and I have discussed her case at length, and we're going to do a lot more searching with this case. I didn't hear a heart murmur, but sometimes we can have a congenital heart disease or something else going on they haven't reached the point where they're not compensating, so we can't see it. The other thing that's hard to talk about, so we don't adopt stallions out at Horse Plus, but spaying mares is extremely challenging. I've only seen one mare spay, and I was not the doctor. It's extremely challenging because the ovaries are inside the abdomen, and abdominal surgery in horses is incredibly challenging. The aftercare is really challenging, but picture this little mare is only 2 years old. We believe she has a reproductive tract, and if someone adopted her, even not intentionally, if she were to be bred, that pregnancy could be life-threatening for her and for her baby. And so we have to think about that. Part of our job as an animal rescue is to think about adoptability and concern. And so there are ways that you can sterilize mares, but my biggest concern with her right now is that's a pretty severe congenital abnormality. Are there other things? So we have a lot more blood tests and ultrasound and things that we're going to do to make sure that she can live a comfortable life.
This is his leg.
Oh,
was just
man.
oozing.
Yeah, we had 3 with really bad puncture wounds. This was a thoroughbred gelding. He was only 11 years old. And he had severe lameness on this right front leg. You can see the puncture wound just on the side of that carpus. And when we took radiographs, they were textbook for what we call a sequestrum. So a sequestrum is a little piece of infected bone that's become devitalized. In this case, it wasn't just, oh, there's just one little piece of bone from about here to here on the radiograph were rough shards of proliferative bone, and then the little piece of dead bone was straight in here and attached to the bones in this joint. So sometimes you can do surgery and remove a sequestrum. It's the only way to stop the chronic drainage, but in this horse's case, the portion of bone affected was probably 6 inches long. And I don't know, I used to work for a boarded surgeon. I don't know any surgeon that would recommend a positive outcome in this case. It also was already very badly infected. He was a very, very good boy who loved the cookies.
And I
but
think
he was given the last act of kindness.
This case too is he had shoes on. He had, obviously somebody was doing something with him, and it got to a point where they're like, can't fix it, send him to slaughter. And we're just so thankful that through your support we were able to intercept him. But so much of the work we do here is literally just stepping into an owner that we're stepping into shoes when the owner walked away.
Yeah.
And as long as the safe act is not happen, where slaughter is outlawed, we're going to continue rescuing horses that their owners walked away because they knew it wasn't fixable. And it's a hard job rescuing these animals, knowing that we're going to have to say goodbye to a lot of them that day. But it's something their owners should have done, and that's why we need the SAFE Act to pass.
Yeah, we had to euthanize 11 of the 21 horses that came in yesterday. But every single one that we had to say goodbye to, it was like, these poor animals. The decision should have been made a long, long time ago.
This one sought human attention out.
This
like
poor boy. He was 28 years old. He was a standard bred, but he was not branded. And man, he had significant dental pain. He had pain on palpation of his back. He was blind and painful in both eyes. And he had he had at least 3 auction tags. So this horse couldn't see anything, couldn't navigate. He had a lot of uncontrolled pain, and you can see how he's holding his mouth. He would try to kind of take treats, and he almost couldn't get food into his mouth. And he just had a lot of uncontrolled discomfort. Even with pain medications on board, he continued to have an elevated heart rate. And one of the things that I have to think about in my role here is cost-benefit analysis. So I love surgery. I do surgery all the time, but even though we remove eyes a lot, it's a major surgery. It's removal of an organ. It's right next to the brain. And as a 28-year-old, knowing that he likely would only have had maybe a few more good years, it was a hard sell for me to recommend doing major surgery on both eyes, knowing that he also had pain in other parts of his body. So he was given the last act of kindness.
It was a very, very sweet horse, though. I'm assuming that he was an Amish horse all of his life. He didn't have a brand, so he was probably born from a standard bred mare on an Amish farm and was just a cart horse all of his life. But I was hanging out with him while they were all taking care of the other horses in the barn, and he came over, he put his head on my chest, he wanted attention, and I gave him a really good massage. And I think the hardest part of all this, oh dear.
Don't start, Tawny, I'll start crying too.
We have both been crying today.
Yeah.
So, oh man, it's just, we let a part of our hearts go with each of these horses. And it's hard to want to, like, he wanted love, he wanted this. And as you're loving him, you're knowing that you're going to have to say goodbye. And that's a hard part of what we do.
But you have to be there for them if they want that. It's the only fair thing is to give them that comfort and that energy and love that we have. And I take comfort knowing that somewhere out there, these horses that love people and seek out attention, somebody really loved this animal. And I always wish, like, maybe someone will watch this, although how heartbreaking, right? Like if you had a horse that you loved, to see them happen like this. But I always wonder, did some little kid love this horse? And so we try to give them everything we can.
Like Dr. Lydia said, if they come seeking love, even though we know it's going to make it harder on us, we want to give them that love.
Yeah.
He is a really sweet horse.
Yeah. Sorry, Tony.
And then we have this poor girl.
I know. It doesn't get easier. This mare was a standard bred. She was a branded standard bred. You can see her tail was cut, and she was only 21 years old. Her name was Beautiful Illusion. We were able to look up her brand. And she came in with a heart rate of 88. Upper end of normal for horses is kind of upper 30s. These pictures were taken after pain meds.
Yes.
But Tawny noticed that she was showing pretty acute signs of abdominal discomfort. So colic is a non-specific term for some kind of abdominal distress. She was pawing and kicking at her stomach. She was kind of throwing herself on the ground and rolling. And she was given 10 milliliters of Banamine, Flunix and Meglumine intravenously, and also some xylazine. So xylazine is a sedative, but it causes a decent amount of pain control for the abdomen. So when I see colic cases, that's what we reach for. With both of those medications, her heart rate came down, but only to 56. So upper end of normal is kind of upper 30s. So she still had a pretty high heart rate, and she had no gut sounds. So when I first went and listened to her, normally we talk about 4 quadrants. So there are 4 spots that you listen to different parts of the equine GI tract, and there wasn't evidence of movement. So you always want that movement. If the GI tract isn't moving, it's a really bad sign. And then when I looked at her gums, she had a little purple, what we call a toxic line. So colic happens pretty frequently in horses. There are a lot of different causes of it, and many of those causes are very treatable. But when we have evidence of a toxic line, that often means we've got bacterial translocation often in the bloodstream, and it is a poor prognostic indicator. So we gave this mare some good pain meds. She did show an improvement. She went over and drank some water. Her GI sounds improved a little bit, but even with good pain meds and sedation, she just kept throwing herself on the ground over and over. And we talked about trying to keep her going. What's hard for me in these cases, and I have to shut that part of my brain off, somebody cut this mare's tail, and she was very sweet and very halter broke. And so I always look at that. I have my horse's tail. Mm-hmm. Not everybody does, but it's something that we can remember our horses by. A lot of people make jewelry out of it. And so I see that, and I think somebody that didn't care about this horse wouldn't have wanted to keep that tail. So why was this mare dumped into the slaughter pipeline right after someone had cut her tail off and kept it? We don't know. But I always take note. And we actually have gotten some horses with cut tails to adoption. Just because they have a cut tail doesn't mean there's no hope, right? But it does mean to me that someone knew something was going to happen with that horse. So this mare was given the last act of kindness. Dr. Gina and I have successfully treated a good number of colic cases, but this mare showed evidence of probably a torsion, a small intestinal type colic, and small intestinal colics tend to be surgical colics. We do not have the capacity to do GI surgery here at Horse Plus. It's something that generally only a boarded surgeon does. So she would have had to go to Tennessee Equine colic surgery. I don't know.
And at her age,
$5,000 to $8,000
Yeah.
with a pretty poor prognosis at this stage, because she'd probably been colicking for several days.
And if you have a horse, like we do see a number of horses in auctions over the years, so many horses with their tail cut, and it's something that a horse owner does when you're saying goodbye. Mm-hmm. You know that horse needs that tail to swat flies.
Yeah.
It's the last, you're saying goodbye and you're taking a memory. And if you're making that decision for euthanasia, don't rely on a transporter to take your horse to the vet and take care of everything for you. Sadly, there is way too many cases out there where, okay, here, I'll pay the vet for you, I'll take your horse to the vet, give me the money, you won't have to worry about it. And instead of that horse going to a vet, it goes to auction into the slaughter pipeline. And then you have given the guy the money for the procedure of euthanasia, and he's going to make money off of your horse. And if you don't have a horse trailer, I know it's hard to get a vet to come out on a ranch call these days, but if you are having your horse transported for humane euthanasia, go with them until they're unloaded. And if you can't be there when it happens, that's fine. but be there as long as possible, and know, as the horse owner, know that you got that horse there, or take it to a rescue like any of the organizations is within the Full Circle Life Horse Shelter Network that we've been building over the last 5 years. These are organizations that will take your horse, and I have 100% confidence in them. I've mentored them. I know that these are good organizations, because it is hard being there for your horse in the end. But you don't want your horse to say goodbye and think that everything's fine and have it go into the slaughter pipeline. Oh, then we got this baby.
This little filly is about a year old. You can see that she's pretty covered in mud or poop, based on smell, probably poop. So she had been laying down a lot on both sides of her body. She had a big scar over her right hind leg, and she has pretty bad lung sounds on both sides, some inspiratory wheezes. She also looked like she may have fractured the orbit over her right eye historically, but she was very, very sweet. Came right up, very affectionate. And she had some scarred submandibular lymph nodes. So I suspect, like that other young horse that we saw, she may have had strangles or some other respiratory infection. We gave her some broad spectrum antibiotics, and hopefully we'll be able to pull her through with some strong supportive care. She was super, super thirsty when she came in. She kept coming back and drinking more water and drinking more water. And then when she'd had a bunch of water, then she was really obsessed with the salt block for a while. Like, even though she had access to hay, all she wanted to do was drink and have access to salt. So she has been put, she's in a quarantine pasture by herself, because she's going to need a little bit more intensive care. And I'm really concerned about her. Hopefully we can get her turned around.
Yeah, and she's one of those horses, it's like, what was her story?
I know.
Because usually the young horses we get in, they're wild, they're scared. She is halter trained. She let Jordan pick her feet up, her front and back feet. Like, somebody at some point did a lot of groundwork with this little filly, and we don't know why she's in the slaughter pipeline. I know, like, her lungs sound really terrible, like there could be some major things we just don't know at this point, but she's adorable and very sweet.
This little mare is only 5 years old. She had a halter on, but I'm not sure anyone has ever held the other end.
I don't think so.
She, of this entire group of horses, was extremely fearful and distrusting of people. And I think she's a strong trauma survivor. She was very, very agitated, just spinning in circles, not wanting to eat anytime people were around. She, unfortunately, like some of the horses that we have come through, we had to put in we have a hydraulic squeeze chute. So we have to be able to put our hands on these animals and get blood samples and listen to their heart and lungs. And so we had to put her in our hydraulic chute and squeeze her to do anything with her. So this is where Corey sometimes is able to work wonders.
And yeah, on the training side, but
and the decompression period is also very important for these animals, but sometimes decompression isn't enough. Health-wise, I was not able to do a thorough physical exam. She did have a wound. You can see some dried blood on the right hind leg. That looked to be pretty superficial, but this mare would not allow us to touch her. So she is turned out, and hopefully we'll have some decompression period. You can see she's quite thin. She's getting actively refed, and hopefully we'll be able to turn her around and win some more trust in people. Sometimes these horses become a real danger to themselves. So one of the things that was most concerning to me about this mare is that even squeezed in the chute, she was so hesitant to allow any hand near her face. We have to age them, right? So I had to touch her mouth to check her teeth, and she tried to flip over backwards. She was so terrified of my hand, even moving slowly and having treats. She was so afraid of my hand that she tried to flip over backwards, squeezed in a chute, and we had to unsqueeze her, and she did fine with that. But that level of trauma response to humans is really, really concerning.
Before we squeezed her down in the chute, when she was in there, like, I put my hand just on her, and she immediately started opening her mouth like she wanted to bite. She started kicking with her back leg, and then she ended up striking. And so when they go in the chute, like, hey, can we handle you without the squeeze part? And she's been through a lot. So hopefully she takes time to breathe and realizes that we're good here, but time will tell. And we got this cute little guy, which is like, I think the little Jim, he might not be the brightest bulb, I think is what you said, but he's a good little Jim.
He's a real good boy.
Yes.
He is a possible cryptorchid, which means he might only have one testicle descended, but he's only a year old, and he was a very good boy. He, I said he wasn't the brightest bulb in the tanning bed because there was a gate.
Oh, that's what it was.
A full gate
brightest bulb
right
in the tanning bed.
And he went right up to the entrance, and he was like, I can't find how to get through, and I had to show him. But other than needing castration, we didn't note any concerns. You guys here are probably sick of hearing me talk about our ultrasound, but
it's amazing. It's
new
amazing.
Technology. So our ultrasound can penetrate to a depth of 30 centimeters. Usually, when you have a cryptorchid colt, that testicle is like just inside the inguinal ring. So the testicles start out in the abdomen, and then they descend through this little normal physiologic hole to the outside. And so if you can identify where it is, then sometimes you can, from the outside, reach up, or with a surgical tool, you can get it. When you don't have diagnostic technology that can penetrate that far, and an x-ray would be useless because x-rays are just looking at bones, you're just guessing, and you can't just blindly cut into the abdomen. So we've saved at least one horse since getting the ultrasound, which we haven't had it that long, with a testicle that I would not have been able to find otherwise. So it's incredibly nice to have that, and I feel a lot more comfortable. Unfortunately, if we have a true cryptorchid and that testicle is up in the abdomen, the only other way to find it is to open the whole abdomen, which I already said in this video, we do not have the capability to do at Horse Plus. I've been a part of one of those surgeries at UGA, and you basically have to eviscerate the horse. So you have a giant sterile table, and you take all of the guts out until you can get to the back part of the horse back here, and then you reach way down in the abdomen, and then usually you can find the testicle that way. But then you have to very carefully and in a sterile manner put all the guts back in, and that inherently makes you at risk of colicking. This is not every cryptorchid surgery. I have an N number of 1 that I watch, right? But it's not like, that doesn't sound like a big deal. It's a big deal. It's not something I would ever feel comfortable doing. So, and then the other thing that happens when that testicle is retained is not only can you have stallion-like behavior, but often they get tumors. We're not really sure exactly why. It can happen with dogs too. A retained testicle is at a different temperature, and often those cells become neoplastic, and then they end up with testicular cancer. And you might not even know. It's unethical to take one testicle. If you only find one, you're supposed to leave it. But sometimes, who knows those circumstances, sometimes cryptorchid horses, somebody removes one testicle. It's legal in the state of Tennessee for owners to castrate their own horses, which in my opinion shouldn't be legal. But so if you don't know any better and you take the one testicle, then you could sell that horse as a gelding, and without running blood work to check testosterone levels, you would never know it from the outside of that animal, and it can be a big problem. So hopefully this little guy will have
he's
two
he's
testicles,
gonna be good.
and if he doesn't, hopefully we'll be able to find it with our ultrasound. And that was the last horse in this buyout group.
Yeah, so just thank you so much for watching. We know if you've gotten this far in the video that you're really dedicated to knowing what's going on. So please leave us a comment. Let us know how you like these debriefings, if we should continue them. And thank you for doing what you can. Even if you just watch this video, the monetization from this video can help. There's just lots of ways to help, but that's what happened yesterday, and that's where we're at right now, and we have another group coming in, so please consider making a donation.
I'm really thankful for this opportunity because understanding what Horse Plus does is really tough. We're saving these animals that 100% would have ended up deceased in an unethical manner. So as hard as it is that we often lose half of the animals we take in, I think it's really important, and it speaks strongly to my heart that we're able to save these animals from a really horrible end and give them an ethical end. And we love to talk about the happy endings where they end up getting adopted into good homes, but a lot of what we are about is just alleviating suffering, and we couldn't do that without continued donations. Even though we have to say goodbye to a lot of those horses, we're still saving them.
So we hope you've enjoyed this debriefing. It's a time for us to be able to let you all know what happened with these horses, and then for us to be able to, we addressed it, we cried, we're moving on, and that's really important for us as a team, because we can't constantly dwell on it.
Yep.
If I have to keep thinking about the horse I had to say goodbye to, I mean, obviously there's processing that goes on there, but you know, every question, what happened to that horse? I have to think about it, and then how am I going to write it down to explain it all? So that's one of the reasons we're doing these debriefings, because we know you want to know what happened, and it's a really hard job we have here, and it's a very important job, and that's why we do it. So thank you.